if somebody who has had prostate cancer, who's had their prostate removed, how that might exacerbate pelvic floor symptoms. Is that your
Yes.
question? Okay, so if somebody's had their prostate removed, I always tell patients the prostate is the floodgate. It's the failsafe for the bladder. And as people with penises, that's how our anatomy works. So we don't have as many urinary control muscles as women do. And so when the prostate gets removed, the internal urethral sphincter also gets removed. And the internal urethral sphincter is the one that really closes off the neck of the bladder so that we're not peeing all over ourselves. And so when the prostate gets taken out, a lot of times people really struggle with incontinence and leakage. And so we have to do a lot of work really bulking up and strengthening the external urethral sphincter, which is a part of the rest of the pelvic floor, so that they regain continence and they're not peeing on themselves anymore. With radiation, it's a little bit more tricky, and it's really even more tricky if I get them without having any sort of like prehab before their radiation, because radiation is really difficult. It's almost impossible to train and strengthen radiated tissue. And so if their prostate has been fried with radiation and their internal urethral sphincter was also a part of that radiation, they can also experience the same type of leakage as somebody who's had their prostate taken out, because the radiation has just zapped the muscle's ability to contract or relax.